We'll quickly talk about the next disease conditions, alright, before us. So we'll talk about the Poems syndrome. So alongside the Poems syndrome, we'll talk about the Castleman disease, alright. Alongside the Poems syndrome, we'll talk about the Castleman disease. So for the Poems syndrome, okay, let's describe them first of all. They are rare, they are multisystem disorders, okay, and they are often associated with what? Abnormal plasma cell activity, okay, and also immune dysregulation. So let's look at the details on it. Now, Poems syndrome is actually a mnemonic, like it's a short form for polyneuropathy. So the P in here is the P here. Organomegaly, the O here is the O here. Endocrinopathy, the E here is the E here. Monoclonal gammopathy, the M here is actually the M here, you know. Then you also have skin changes, okay. So key features in this is polyneuropathy. So a lot of nerves are being damaged, you know. Organs are getting enlarged. Hormones are not balanced. Skin changes, so you're having your skin color is changing and all of that. The presence of M proteins in blood. They have lesions in your bone. So maybe associated with Castleman disease. Do you understand? That's why we actually discuss them together. You understand? So Castleman disease now itself is a group of what? Lymphoproliferative disorder. Okay, have two main types: unicentric, a single lymph node region is affected; multicentric, a lot of lymph nodes regions are affected, you know. So key characteristics: lymph nodes are enlarged, such a person is having fever, the body is weak, okay, weight loss, then the way your organs are functioning is disrupted, you know. So it can be associated with human papilloma virus type 8, the herpes simplex virus type 8 rather, then sometimes it's idiopathic, sometimes it's driven by interleukin 6 overproduction. So most of the times it can coexist, okay, with the Poems syndrome. All right, so that's it for these two disease conditions and how they actually affect the human body.